We moisturise to repair the skin barrier, to maintain the skin integrity, and importantly to reduce transepidermal water loss and restore the lipid bilayer. So that's shown in this slide here. So here we have the lovely bricks and mortar pattern of normal skin, the bricks being the corneocytes or keratinocytes, and the lipid bilayer being the mortar in between. And eczematous skin looks like that, which translates to all this skin scale. And that's what moisturiser is going to normalise. So types of moisturisers, I mean, there's a bewildering array, and various GP friends of mine said when I was preparing this talk, well, you know, what moisturisers should we recommend? I think the simplest way to think about it is occlusive moisturisers, creams and lotions, and it's all about the fat to water content. So the occlusive moisturisers are just fat. They're oily, they're not absorbed. They reduce transepidermal water loss, but they sit on the skin surface. Children will cope with it because, well, A, they don't have a say in it until they get older, but B, you know, they're not really greasing up important clothes, but your adult patients really won't like any of this. And in fact, if I actually ask adult patients to use any of these moisturisers, I would always say, you know, use it at night because otherwise it'll ruin your clothes. So examples are emulsifying ointment, white soft paraffin, QV intensive. Very useful moisturisers, great for dry, like hennified skin, and as I said, good to use at night. Creams contain about an equal fat to water ratio. So, you know, QV, Cetaphil, Aveeno, pictures of all of them. They're very useful for maintenance. They're good in warm weather because, you know, obviously they're not as occlusive. If you've got weeping eczema, then creams can be very useful. And then lotions have a much higher concentration of water to fat. So they're the ones that the patients like. But typically I don't tend to recommend these unless, as I said, you know, for hairy areas or if they have superimposed folliculitis, then creams can be useful. The newest developments in moisturisers are moisturisers that contain these breakdown products of filaggrin, which, as I said, is the missing gene in up to 60% of patients with atopic dermatitis. So when filaggrin is broken down, it forms natural moisturising factors. And there are some creams, Cetaphil's Restoraderm, and then Eucerin makes one as well. I'm actually not sure whether this one's available in Australia. I only found it on the internet that it was in the US, but I imagine it will come here soon.